welcome to the first Sunday Best FAQ live exam prep series or live FAQ session that we have. Not necessarily exam prep, but welcome to those who join. Again, my name is Steph, the massage therapist. I am going to be with you today to help you answer your questions. So let me just check my phone and go to Skool, our Skool community here, because I think on our day 2 series, I was asking most of you that joined about the questions that you guys are very interested in and me answering, right? And most of those are actually very much related to assessment and palpation, which is a good time because usually those are the two topics that are very not controversial, but it's a bit hard for some people to grasp. So let's go ahead and answer the questions, right? So again, it was in the end of day 2. So basically, I was asking that, what are the FAQ questions that you want to ask? So let's start with the first question. So, I mean, most of these are the same. So I'm going to read the similar ones. And then I'm going to give you a sample demo of assessment and palpation included to help like one of our viewers here on how to access that. And feel free to ask your questions at any point of time via chat. I will try my best to look at them right away so that at least I can answer your questions accordingly. So the typical questions that I have received on that post is, I'd love to review assessment, contraindications, and clinical reasoning, especially how to decide, treat versus refer, right? So just to answer a little bit of that question on how to decide to treat versus refer, always remember to see if it's within your scope. So you can still do an assessment, figure out if you can treat it under massage, but then if you feel like there are things or most of the things that you found out during your assessment is something that you have to refer or send to the hospital, if it's a very worst case scenario, then definitely you have to refer them. So for example, maybe a client came in, right, said that, oh, I have a very 10 out of 10 pain on my leg and it's really painful. And then upon your assessment, you've seen that there's a difference between the right leg and the left leg, indicative of deep vein thrombosis, which is something that you should not massage because it's a total and absolute contraindication. Then definitely you have to refer, right? Another examples would be, let's say when you did your assessment and then you realize that, though I can treat this, you may not have the right skill set, or you're not really confident of doing a specific technique, that you may want to refer them to a chiro, a physio, because maybe the treatment they're looking for is very much heavy on the, what's the right word? Very much heavy on the joint mobilizations. Though at school, we were taught about joint mobilization, but remember, we only do the light mobility, the soft tissue mobilization, not really the high manipulative ones that chiropractors and osteopaths are doing, because we're not really trained for that in basic massage therapy. So if you feel like the patient is required to have more of those than the modalities you're currently doing, then feel free to refer them. It really depends on how your assessment worked out. So that's something that I will be showing to you as well. More common questions that I've seen is more on how to do a right assessment on certain conditions, definitely, right? And how to perform and remember all assessment in OSCE. I'm going to also try to show you on how to remember all of these once you graduate, right? Because OSCE is just one step of you becoming an RMT. If you are not from Ontario, then this is still a good learning curve for you, because assessment is actually a good marketing strategy. If you can show to your clients that you know what you're doing, you know what you're trying to say, you know how to find the issues that they want solutions from, then you can always use assessment in your favor to get more retention clients. I would usually say in business, especially in this field, you need to understand that new clients is not a good, it is a good way of determining that your business is growing, but it's more of client retention. How many patients or clients are booking every single month? How many of them are returning for the whole year? Because if you have new clients versus recurring clients, like sorry, let me rephrase. If you have more clients, newer clients than retention clients, it means there is something off there. Why are you just having new patients? Where in fact, you should be making sure that the patients that join your practice are always coming back, meaning they love your service, they love what you do, whatever treatment you give them is basically what works for them. And again, word of mouth starts from there, where it is one of the best marketing thing that we can do in massage therapy. So yeah, so I will help you use assessment accordingly for that. Another one is this one. This one is a bit longer. I'd love to watch. I'd love to learn more about techniques. I have watched your recent YouTube videos about principles of massage. I would love to learn more. What can I apply on my upcoming OSCE this year? I'm so nervous about the exam. I feel overwhelmed about the information. It would be nice to have a session about techniques. Thank you so much. For this one, though, because my demo didn't really consent for techniques, I may not be able to show you that. However, I'm going to give you tips on how to perform these techniques in an OSCE scenario. Okay, so hopefully that helps. And then another long one here is, hey, Steph, I'd really appreciate some guidance on how to confidently and correctly perform palpation of structures, bony and muscle for assessment 2 station. This is actually one of the hardest sections. That's why I do understand that. I'm a bit confused because some instructors says we need to trail bony landmarks, while others says it is not necessary. Clarification on what examiners are expecting would be super helpful. Those ones I would consider, I would also give you as well. But to give you a little bit more specificity on this, it's not about what they're looking for. Sorry, let me repeat what I'm saying. Yes, it's about what they're looking for, but it's also about what the exam criteria is providing. So for if you are in Ontario, or it doesn't matter which province you are right now, always remember that there is no exam in the entire world, just in Canada, that doesn't have a basis of examination. Every exam has a criteria, has a breakdown of what kind of questions to give, what kind of categories of question. Is it application, comprehension, evaluation, creating, what kind of thinking questions they're going to give you? Everything is in an outline. For Ontario, because I'm from here, most of these are going to be available on your exam handbook. So now it's 2026. I'm not sure if the Prometric or the CMPO website already uploaded their 2026 handbook, which has all the exam requirements that would come out of the exam, right? For me, my best advice for OSCE is to focus on what they're looking for. Though advices from tutors like me and other tutors that you've seen before, instructors, classmates, and friends, I always say take it with a grain of salt, because their experience is not always going to be your experience. Okay, I want you to understand that. Reason is, in an exam setting, what's important is to make sure that you follow what they want to see, which is already on those handbooks. All you need to do is check those handbooks to ensure that you are in line. Though it's not very specific, right? I mean, it has enough information for you to practice on your own, for you to practice with peers and classmates and friends, loved ones. It has enough information to see the whole picture, but don't expect that they're going to feed you the answer, because it defeats the exam purpose. So my suggestion is, despite of what the advices that are given to you, focus on these criteria outlines, right? If it's not on the handbook, usually they have an exam outline of what are the topics that you should learn at this point of time, especially if you're graduating. Reason is, number one, we need to make sure that there's a basis for everything. So yes, it's not bad to listen to friends and family, like family members, if you have some family members who took the exam as well. It's not bad to hear what they have to say about the exams if they took it. The question is, does it really match the answer? Because nobody knows what you got right. You only know if you pass or you don't. So how can you guarantee that their advice really fits yours? Because nobody knows what happened to their exam. They can keep telling you stories that, hey, this is how it went with me, and I think I got wrong in this. That's what I'm saying. That's what you think. So again, please let's control things that we can control, right? Which is like we have the outlines, we have the handbook, we have the steps that we need to follow. So why not use that instead and practice what we know? It doesn't matter if other people are giving their advice. You can still take them, but take them with a grain of salt. All right. So we have more people joining. Hello, hello there. Welcome. We just started answering a few of the questions here. And to answer the major question, assessment, I figured that I would show you a full assessment, right? I'm going to try to use only the exam assessment used for OSCE. Okay, something more realistic for some here that doesn't require exams like Alberta, because once you graduate in Alberta, you don't need it. So at least you see, right? And then from there, you can start asking your more questions and we see from there. So to start, let me call on my volunteer for today. My volunteer that I voluntold doesn't have any choice, but yippers. Are you ready? Okie dokie. So you can take a seat here. Yes, take a seat there. And I put my phone here. I'm not going to be using it. Let me see if the camera is following. There you go. So for this demonstration purposes, this would be heavily focused on really figuring out what his condition is. I'm going to try utilizing all assessment techniques from client interview going forward, though I'm not going to be able to just sit here, like find a chair because of space limitations, but I'm going to try my best to give you everything. Now, demo, what I want you to do is really find a problem in your body right now that you want, you want solutions. Okay, so I'm going to try my best to actually look for it, right? And then for those students who were asking about palpation, I'm also going to include that here, because even in my daily practice, I use palpation a lot to assess. Okay, but then for the palpation part, I may have to add a little bit of words with it and then give some tips. So if you're ready, if you're available, just click the thumbs up there. If you're ready, then we can start. Yes, more thumbs up. Perfect, perfect. So let's start, okay? So let me just move up here. Okay, so hello, Kim. My name is Steph. I'm going to be working with you today. So before we start, may I know your primary concern of coming in today? My right arm. Stuck. Okay. If you can't hear him, you can always tell him to speak loudly. Okay? So going back, so you have your right shoulder pain and you're having a hard time raising it up. Okay. So can you pinpoint to me where you find it, where you feel it? So it's more here at the back. Yeah. Is there any other places that it runs to? So, okay. So when you feel pain here at the back, let's not keep moving it. Mm-hmm. So not, what do you call it? So it doesn't aggravate much. Okay. Sorry about that. But from here, do you feel it towards, like, do you feel any numbness and tingling at the back of your hand exactly here? So is it just numbness and tingling or it's impaired sensation? What do you feel? Achy. Achy. Where? Like achy going down your arm or achy here? Back and then tingling. Okay, so at here on the top, you feel that it's a painful, achy to be precise. but then going down from the shoulder, going back to your to the back portion of your arm, you feel that it's tingling, but not numb.
Yeah.
So both.
Mhm.
Okay. Alrighty. So when you feel this, do you want, I mean, do you do a specific movement or it just pops up? When do you feel it?
Every time I move my arm
So is there any specific movement?
towards motion, any motion.
Any motion? So okay, we're gonna have to check that later. So you said okay, and I would assume that the frequency would be on and off, right? Because you said it's every time when you move.
Yeah.
How about when you sleep? Do you feel it when you sleep?
I don't know. It's like sleeping.
Of course. But what I'm saying is, or you have, sorry, you know what? Let me rephrase. Do you have like, do you wake up at night because of the pain?
No.
No. Okay. Or do you find yourself in a sleep position and then you're like, oh, you know what? It's a bit painful. I wake up.
Yeah.
Still no?
Yeah.
So it's a yes.
Yeah.
So is it when you sleep on this side or this side?
This.
Okay. So if I'm going to give you a pain scale right now, I'm going to give you for two parts. For the one on the shoulder and the one towards the arm, right? Which ones in here would you feel like, sorry, let's start from here. If I'm going to give you a pain scale of 1 to 10, 1 least painful, 10 most painful, 7 tolerable pain, what would you feel here?
7.
7. Okay. So it means as of the moment. But when you're not really doing much, what would it be? 5 out of 10. But if let's say you're having extra weight, so you're lifting something,
Yeah. 9.
okay, does it increase
Yeah.
as the
Yeah.
so let me rephrase. Does it increase as you lift more weights?
Yeah.
Okay. How about the numbness and tingling that you feel at the back of your arm and your forearm
Yeah. Skull goes up.
as you lift heavier stuff? But what if it's just like this, like you're sitting down like this?
It would hurt.
So in that hurt a little bit. What's the pain scale that you
Or
4 out of 10? Okay. And besides working, is there anything that aggravates it more or moving?
moving.
Besides moving, anything else that you can think of? Okay. What makes it better? What relieves your pain? What do you do to help this?
Medication.
So what kind of medication are you taking?
Tylenol.
How often?
Twice a day.
Did you take Tylenol today?
Yeah.
When was it?
Morning.
So morning, what time in the morning? Now it's 2:23, so what time in the morning?
8.
Okay, so that's good for, because sometimes, okay. And is there anything else you want me to know about this scenario? So, I mean, this, it's not scenario, the symptoms that you're experiencing right now?
No. That's it.
Okay. Alrighty. So, for those who are watching, the first part that I have shown you is basically a client health history, right? So in most OSCE scenarios, those are going to be a separate type of station. I just feel like it's nice to have that information because I need to know the client's story about what happened in in his arm or in his shoulder. So now you can actually see two conditions from going forward. So now I'm going to ask you while you're here, any guesses based on the interview? Okay, you can type your answer there. Any guesses of what you think it is? Or if you don't know what the condition is, you can give me what do you think, what muscle is affected at this point of time? Just comment it down below. Okay? Let's see, Macho. Let me check my phone. Let me check my phone here. What do you think? What do you think? Do you think a nerve issue is affected? Oh, sorry, you still see me? My camera is not working good. So let me work with the camera. Okay, anyway, I'll just move it on my own. Okay. So, stop moving. Okay, no answers yet. So I'm just gonna give you some answers here. What I think it is it's two conditions divided into two, right? Maybe it started as a shoulder injury and now it's affecting the nerve at some point, right? So we do need to assess with that. Now we have to follow a very straightforward approach because some of the FAQ questions that you guys posted is asking how to connect the right assessment into the problem. So that's the first step, asking the client's story. Okay. So for those of you here that just started the program, like one of you guys, this is why client health intake is important because you get the full story, you get a full picture of what are the things that you might have to work with. To be honest, as he talked to me about the symptoms, there are some tests that are coming in my noggin here. However, there are tests that I'm not fully comfortable of performing. And this is the time to admit that you will not remember most of it. You will not remember most of the tests, especially if you're already practicing for those who already graduate. But for an exam perspective, another tip that I can give you is that if you really want to remember the test, you have to correlate it with a specific condition. So for the next bit that I'm going to show you, I will be looking for some tests here because I'm not sure with the other tests. I'm sure with the other ones. But again, correlating the symptoms and looking for the right test would be the best way to find out what assessment to perform. Okay? So let us continue. Your speakers. Already in the middle. Zip following. Or following. Okay. Would you be kind if you want to you want to move there, stand there? Okay, the reason why I want him to move there is, sorry about that, is because we just don't have the space. So let me just see if this, now it's following. Okay, so, okay, Kim, if you can face me here, facing the camera, and I want you to move a little bit closer. Okay, so move a little bit there. Oh, sorry, towards here. My direction is very bad. Perfect. So just so that everybody can see. What we're going to do is a range of motion testing. Okay, range of motion, basically, there are a couple of movements that I want you to do. Just let me know if you feel any pain or discomfort. At some parts, it's going to be some popping or weakness. So I'm going to just identify. So the first one is active range of motion. For this one, you are going to do the motion on your own. You just have to follow me. Okay, so let's start with put your hands on the side, step back a bit on the table, please. Perfect. And then from here, from the side, I want you to lift your arms up towards your ears like this. Okay, can you please do it? Stop if you feel pain. Okay, so you feel pain with that? Okay, so please go. Now from there, I want you to put your palms facing forward, yes, and bring your arm up and stop if you feel pain. That's it. You feel pain there. Thank you. Very good. My angle is not really perfect at the moment because I should have been there on the side to see the angle. But for this purposes, to not just, restrict the view. Okay. So can you please face that way then? Okay. Can you try to bring the opposite way? So instead of going forward, you bring it back. Okay, please bring it back. Any pain or discomfort? Okay, where? On the front, so it's not here on the back here.
Oh, it's here.
It's here and here. Okay, now I want you to bring it back. Can you do it again? Okay, any pain or discomfort, the same areas?
Yeah.
Okay, I'm not pinching him or anything, just so you know, I'm just stabilizing his shoulder because I noticed when he did it, he kind of moved a bit. The reason is we want to isolate the joint, that's why we want to do that like that. Okay, so now can you raise your arms a little bit and make a 90-degree angle? Any pain or discomfort when you do that?
Yeah.
Where? Here in the same area? In the same area. Okay. So okay. So can you try bringing in your arms in? Any pain or discomfort when you do that? Okay. Is it in the same area? Okay. Can you please bring it up? Now can you do the opposite side, please? Oh, that's a bit limited. Any pain or discomfort in the same areas?
Yeah.
Okay. Now you can bring it down. Okay. One last question I have. When you were trying to bring your arm down, did you also feel pain with that or no? Slowly.
Good.
A little bit. So in this scenario, the active range of motion is showing that most of the range of motions are actually problematic. In this point of time, if you're doing OSCE, those are the common movements. So let me see if I've done everything. Most of it, I've done everything except the horizontal. So can you bring your arm like this from out in? Any pain or discomfort with that?
Yeah.
All towards the other side. Pain?
Yeah.
The same areas? Or now you have the tingling?
Pain.
Okay. All right. So from there, I want you to bring it out. So do you feel anything there? Which the same?
Here. Here. Back of the neck.
Okay. So for that one, now you felt the back of the neck. For the back of the neck, rotator cuff, maybe, good guess, but let's see first. But that's good. We're guessing. Okay. So based on what I've had, the only thing that does not have that much pain is from from a deduction. So bringing the arm from the top towards the side of the body. Am I right?
Yeah.
Okay, but it doesn't mean that it doesn't have pain. It has pain, but it's lesser than the other ones.
Yeah.
So when the client said he literally feels every single thing that's painful, then it means there's a lot of things going on. But remember, there's only one that made it numb and tingly, which is when you did this motion. Can I confirm? Yes? Perfect. Maybe TOS, maybe that too. Good thinking. But now, speaking of muscle, let me do a couple of palpation here. Can you please sit down here for me? No. You're good there, but facing this way. My instructions weren't clear. I'm sorry about that. So can you please move back a little bit more? Or move back a little bit more. Perfect. It's the right side. I'm bad with directions. So I'm gonna be using the palpation. I'm gonna be palpating this area, around these areas, just to see. I just want you to let me know if you feel any specific pain or discomfort, okay?
Yeah.
Anything here?
Yeah.
So okay. So I was on the upper traps. How do I know? Because the upper trap starts from here, going toward the spine of the scapula, okay? And then I'm gonna just find the spine of the scapula here. How about here?
Yeah.
There is. Yep, I see him twitch as well. Okay. I'm going now below the spinous process. Any pain here?
Yeah.
And any points that I'm
Yeah.
okay? I know for a fact that this client is very ticklish on the armpit. If that happens to you, let them take a breathe in. Any mere discomfort? And it's not tickling?
No.
The reason why I want them to hold a bit is because, maybe they're going to land for react accordingly. Okay. Now, can you sit towards the front for us, please? Just turn around. Perfect. Can I... Any pain? Oh, sorry. There was definitely pain there. How about these?
Yeah.
Okay. So what I'm targeting here is the fact that the biceps are also here. So, yeah. How about around here? So you feel it towards the joint. So now I'm just palpating the deltoids. And then how about these in the front? Not in the back? In the front?
Yeah.
Okay. So the reason why I skipped a little bit of the other range of motion is because I just really want to confirm if it's really muscular. You can do palpation at any point of time of your assessment. I just like doing it after active range of motion because it's still muscular. Okay? And it gives me an idea of ligamentous issues. But in an OSCE, you can finish all three of the range of motion first before you continue. But for this example, in real life, after active range of motion, I usually check palpation because I really want to make sure that if it's just muscle and ligaments. So far on this one, every muscle checks out. It matches what's the problem, except for this one in the front. So I was trying to find the greater tubercle and lesser tubercle where the approximate issue of biceps, right? Biceps brachii is. So again, knowing the origin and insertion is important to give an idea. Why did I pick that? It's because it also has issues with flexion. Though one of you said rotator cuff can be an issue, but the fact that biceps are also tight with him on palpation, it could have been more. It could have been, this probably is a complicated case, right? So, yeah. So now, for this one, what I'm going to do is passive range of motion, meaning to say, I'm going to do the action for you. I'm going to do everything for you. All you need to do is relax as much as you can. Okay, so I do the action for you. Okay, so for this one, I'm just going to move back and on the side. For this one, it's very important that the client is really relaxed. Usually, I would let them be on the table, but for camera purposes, I'm going to do it sitting down. There is nothing wrong doing it sitting down. I just prefer doing it on the table because the client is very much relaxed. Okay, so okay, can you close? Can you put your weight here in my hand? Very good. And what is the rule? What is the rule for this? The rule is you have to do the painful actions last. So as we remember, every single thing for this case is already, what do you call this? It's already painful, but we have to start with the least painful, which is horizontal abduction. Sorry, we have to start with adduction. Sorry about that, because adduction is the least painful, but I cannot do a deduction without doing a deduction. So again, but the rule is once after you do active range of motion, once you go for passive range of motion, you have to do the painful range of motion last, which is for this patient. Most of it are painful except adduction. Okay. Reason for that is you don't wanna aggravate anything. Okay, so I'm gonna lift it up. Any pain or discomfort?
Yeah.
So he did for abduction, and is it in the same areas? Can you pinpoint to me? But now is it more in the front, not on the back?
It's both on the side.
So both on the side. So now new pains are showing up, the back and in the front. Okay, now I'm gonna bring it down. Any pain or discomfort when you do that? Under. So now, is it tightness, soreness, or is it similar pain that you feel? Same. Okay, so now, this is the reason why you just don't stop in one range of motion. Okay? Because sometimes more activities, more testing would show you more. So now, besides the fact that everything is painful, we're now seeing that there are some that's showing. However, the symptoms that he's showing is mostly muscular, except for the fact that he keeps pointing here, which might be, okay, might be considered to be ligamentous, because remember, passive range of motion is to test the ligaments. Okay, so we're gonna do that. Now I'm gonna do this. Any pain or discomfort? Hello?
No.
Nothing. So nothing on that. What if I bring your arm out? Any pain or discomfort?
Yeah.
Where? Is it in now under, but not in the same areas? So that's a good example that, again, it's probably like the first assessment that we did, which is the range of motion, is proving that it's mostly muscular and not ligamentous, because some of the areas are already showing that it's not the positive side. Okay, I'm just gonna lift it up. Release. Any pain or discomfort with that?
No.
Okay. How about this? Any pain or discomfort?
Yeah.
Is it on the same areas?
Yeah.
So what I did was external rotation, right? Can you also show? Yeah, I'm already showing range of motion. So there you go. How about this? Any pain or discomfort?
Yeah.
Is it on the same areas?
Yeah.
Perfect. Okay. Let me see. We forgot something. Okay. So now I'm gonna lift your arms up. Just relax. Any pain or discomfort as we lift up?
Yeah.
The same areas?
Same area.
Okay, but you said earlier it was at the back, it wasn't here. So now you feel here? Okay. So now we're gonna do the last one and just relax. I'm gonna bring it back. Any pain or discomfort in the same areas?
Yeah.
Okay. Nothing changed. So in that aspect, everything is clearly painful except the horizontal abduction and adduction. It's a new set of pain, but it looks like it's muscular. How did I find that out? Because ligaments are closer to the joint. He was pointing under his armpit. So it could have been a compensation. So it means it can be a bit of both too, because we have a lot of pain on active range of motion and now a lot of symptoms coming up with passive. Because remember, active range of motion is testing for muscle muscle health in general, joint health, tendon health, and passive is mostly ligament. So now the last one would be active resisted range of motion. You would do the actions similarly. Sorry about that. The same as earlier. I know the same as last time, but I will put a little bit of pressure in it. But do not overpower me. Okay? So would you be so kind to go back there at the back? And I will be at the back as well. Okay? So what I would want you to do is, again, we have to start with the least painful one. So, but however, the actions that I need to do for this one, I need to start with abduction. So can you bring your arm up, and can you please push? No, please push here, but without overpowering me. Any pain or discomfort on the areas discussed?
Yeah.
Okay. There is pain and his pressure is a bit, his strength is a bit okay. Okay. Though it took him a while to push much. Okay. Now can you push this one? I'm tapping on the top. Any pain or discomfort?
Yeah.
Is it more? Okay. So that's also painful. Now can you please push here? Any pain or discomfort?
Yeah.
Okay, so I was doing horizontal reduction. Now can you please push at the back? Any pain or discomfort? Same. Everything is painful. Okay, let me see what I forgot. Since you're here, I want you to bend this. I want you to push my tapping hand after 3. 1, 2, 3. Any pain or discomfort?
Yeah.
Okay, the same pain, the same areas. Okay, now the opposite side. Any pain or discomfort?
Same there.
Same areas. Alrighty. Now we're gonna do flexion extension. Now I want you to push this one, push. Any pain or discomfort? Do it again. You're a bit stronger here, but do you feel the same pain around here? No. You see how interesting that is? Maybe it's the way I'm holding, maybe there's something else. So earlier, you were thinking that something's off here because everything was painful on active range of motion, but now he's saying on active resisted, he doesn't feel much. Let me correct it. So can you push a little bit more? Does it copy or no? No. So I just did it twice just to make sure that I didn't, test him wrongfully. And you can do that in OSCE exams too. If you feel you're unsure, do it twice because why not? Okay? And then how about the back here? Any pain or discomfort? No. Especially in these areas? No. So I want you to take a seat. Okay. So what makes this case interesting? In the beginning, face. What makes it interesting in this case? I thought, we have some comments there. People were saying, oh, it's rotator cuff, maybe TOS. A lot of answers are coming up already. Sure. But as the progression of the range of motion and palpation, we have noticed that, number one, there's a lot more to here. There was a sign of a little bit of ligamentous part, and towards the end, when we tested active resisted range of motion, which tests for muscle strength, we saw that flexion and extension didn't hurt the patient. So it could have, it still is probably rotator cuff, right? But it could be something else as well. Now, the next step is number 1. Remember he has numbness and tingling? Because now we're done with range of motion. That's the next question we should be thinking. Was there numbness and tingling or any neurological symptoms? In this case, it did have, which is the numbness and tingling at the back of the thing. Okay, so let me test a couple of myotomes. So I want you to do this motion for me for both. Let me start. Again, for dermatomes, usually the clients are not supposed to be that aware. So for this test, I'm gonna do some myotomes and dermatome testing. This is to see if you have any issues with neurological, okay? So I want you to push here. Any pain or discomfort? And then can you push here, please? Sorry, let me correct it. You have to bring your wrist forward. Any pain or discomfort, weakness?
Yeah.
Okay. But the patient said, yeah, pain or weakness? Because I don't feel any weakness from you.
Pain.
Pain. So why am I asking that? Because for the myotones, you're looking for weakness. I mean, pain is a clue, but weakness is what you're looking. Because if myotones is positive, what does it mean? It means that, number 1, that these areas are having an issue with the motor innervation. So there was no weakness, but there was pain. Okay? So can you please push this? This was strong. How about this one with your wrist only? No?
Pain.
Pain. So nothing with that. So not a lot of motor innervation issues. And again, in like if you have extra time, most of you have to do both at the same time. For OSCE purposes, you can just do the arm that has a problem or the area that has a problem, like what I'm doing now. So I'm gonna do some dermatomes. I want you to close your eyes, wiggle your eyebrows. Do you feel any differences, any numbness and tingling as I go here? Nothing. You know what? Let me test the other side too. Any differences between the right and left?
Yeah. That's feeling.
In this side.
Yeah.
Okay. So I saw a mistake there because I only tested the right side, where in fact I should have tested both sides, and I did correct it. The reason is we need to see the differences, because for dermatome testing, that's what we need to test, right? Whether the area itself is having, what do you call this? Any differences. So at first, when I only tested the right arm, he said, yes, it's fine. But then when I decided that I made a mistake and I should correct it, I added the second arm, and he said that there's a difference. So my question to you, if you are still listening, what nerve is located at the back of the arm, right? The posterior part of the arm and forearm. If you know that, comment down below to win a Tim Hortons gift card. We're going to get the first one to get the right answer. If not, we'll see. Okay? So, now that I've done the range of motion, palpation testing, and as well as the neurological testing, now we can proceed with special orthopedic tests. Now, how can I determine what special orthopedic test to use? Number 1, if active range of motion is painful, it means I'm going to find the muscle test, because active range of motion is testing for general muscle tendons, right? Then passive range of motion would be ligaments. So I would also find a test that's for ligaments. And active resistant range of motion is strength. So I'm also going to find a test that tests for strength in muscular. Now, the idea I have would be the following. First, I'm going to start with empty can test to see if this patient is experiencing supraspinatus tendonitis. Why am I picking this? Because supraspinatus tendonitis usually has pain around here, and the muscle is usually, I mean, it's not usually, it is really here and it points out. So, can you please do this motion with me? I'm gonna focus on you. Can you please do this motion with me, like you're opening a can? Any pain or discomfort with that? No? Okay. Now, can you empty the can? Any pain or discomfort? Where? In the same area. Okay. Okay. So that is an example of empty can test. If you notice the language that I use, I really didn't, narrate everything when doing the testing. This same with OSCE, you don't have to narrate every single thing as long as you're doing the right action. Okay? There's a variation of that test too, but I'm not going to do it with him because he did see that he has pain, but you can also resist the pain. I mean, the motion. So can you please do the empty the can and push? So this is the right way to do the test, right? But again, I didn't continue because again, of the pain that he's experiencing here. But as I was compressing it, there was significant weakness. He couldn't even lift it. The strength is less. Okay, so let me see. So we have supraspinatus test. We did that. I also want to test the biceps tendonitis. Reason is he said he has, ligamentous, joint pain around here. So let's do and check that. So how to do this test? I'm going to do the speeds test. So let me find here the approximate location. Okay, so I found the approximate location of the intertubercular groove, which would be the long head of biceps would be located. And I want you, Kim, I want you to do this motion and resist, okay? Okay, push. Any pain or discomfort around where I'm tapping? Yeah. So that's a speeds test. I mean, I just check it this way just to pinpoint the pain, but you don't have to, but there's pain there. Just to confirm a bit, can you do this motion and I will resist, okay? After 3, okay, go. Any pain or discomfort?
Yeah.
Yes, but I didn't feel any popping here, and that test was Jurgensen's test. So there was pain, but there's no popping, so it means it's not really transhumeral ligament sprain, but it is indicative of bicipital tendonitis as well. The last test I want to check is I have to Google this just to ensure because I'm not very confident in this one, but we have the ULTT tests. Okay, are you familiar with the ULTT tests? If you are familiar with the ULTT test, then this one would be a good test for you. So basically, it's these ones, if you can see, the ULTT tests, right? For this one, I'm going to do the one that tests for radial nerve. Reason is because I think that the radial nerve is the one causing this problem. So, radial nerve test. It's going to be ULTT3. Okay. For ULTT3, let's see. So, can you do this motion for me? If you're trying to reach something from the back. Okay. Any pain or discomfort when you do that? Where? Is it here at the back or in the front?
That's not.
That's not in here. Really. Okay. So why did we do that? Because for ULTT, you're trying to put the muscles or the structures in the body in a position where it stretches the nerve. And if there was an issue, it's going to be showing up like that. So we did see that. Now, let's find some rule outs because mostly those are my rule-ins. Let's find some rule outs. Can you please do that motion? So if you did this earlier, can you do this motion like the other side? Like you're trying, how about that? Do you feel any pain around here?
Stretch.
Stretch, but nothing at the back.
It's stretched or stretch. Spin.
Pain at the back, but is it the same symptom that you felt? No. So okay. Now I'm gonna test. I'm gonna do a test for thoracic outlet syndrome as per one of the recommendations there in the chat. So first, I'm going to find your pulse. Okay. Find it. I'm just gonna bring your arm out, and I want you to sit straight. Take a deep breath in. Hold it. 5. Any pain or discomfort? But no numbness and tingling down your arm? No. Okay. One last thing. I'm gonna raise it upwards. Okay. Go look away. Any pain or discomfort?
Same.
The same pain around the area. Okay. So, based on our assessment, I don't know if you started noticing already, but the way I picked my tests was based on the muscle that is affected, okay, the action that is affected, and the areas that is affected. Because my clinical impression for this patient is he does have supraspinatus tendonitis as well as biceps tendonitis because of the results. And because of the tension around the area, most likely he's also compressing his radial nerve. That's why he starts feeling numbness and tingling at the back of his head. Okay. By the way, can you confirm with them that I didn't match you up with this? I didn't know anything of this before. I never asked him about this. This is the first time I know about this. Now I'm a bit worried. However, yeah, right? So at this point of time, it means we have 3 conditions that I'm sure of. And the other 2s that I did, which is the TOS test, is my rule out. I didn't think it's TOS because TOS is focused on numbness and tingling in the fingers, especially the pinky and the ring finger. And none of those symptoms existed in my interview and in the range of motion and in the palpation testing that I've done. So for those people who's asking, what question, how would you figure out what test to use, especially in OSCE, you have to mix and match. If the muscle is painful here, think what muscles are here? What muscles are problematic in this area that's actually related to the problem? And all I can think of is deltoids and supraspinatus, right? Second, I know that active range of motion is basically all muscular. So that gave me an idea that I should not be doing cramps test or anything test like that because it's not that ligamentous. Okay? And then the reason why I take bicipital tendonitis, because bicipital tendonitis is very much close to a ligament problem, that's why I keep pointing the pain that he has here. Okay? So it means that it might be his biceps because even upon palpation, he said that he does have a little bit of tension here. So you see how I used palpation into looking for the muscles just to confirm if it's ligament or not. I don't know if you remember, but earlier I was palpating here and he said ouch, and palpating here and he said ouch. What's the main reason? Most of the insertions of the muscles that we have tested today are all in here. So does it make sense that it's at the back having pain around here? It does. Okay. Again, I want to put a little bit of disclaimer there. This is my way of assessing things, and this is how I usually do things in my clinical practice. Could it be better? Sure. But the point is, were we able to find the matching tests from the conditions? Did we? Because I think we did. Okay. I think there is more into it. But based on what I've gathered and based on the tests that I know, at this point of time, I think my clinical impression is the closest one. Okay? So in OSCE, that's also what you can do, right? Like really match the symptoms, your results to a test. How did I pick that? I saw the results. Okay, so for supraspinatus, the result is painful on abduction. We had all of that, and I matched that accordingly. So that's how you match it. Does the symptoms match the result of the test? That's the question that you should answer. Okay? So, the last question I'm going to answer, because I think we're going to be a little bit having an extra time here, is to palpate. So one question there was saying, how do you palpate and trail and so on and so forth? For this scenario, I want you to understand that the exam will already give you what they want. So if the exam tells you that, oh, it's just the superior attachment of deltoids, then you have to show superior attachment of deltoids. So if I'm going to do that, I mean, I'm still gonna trail as an instructor. The reason is it's for my own benefit. Training the muscle is like navigating, right? Like if you have a GPS in your phone and they say, oh, you have to go out of the plaza to get to McDonald's, you would see that on the arrow as well. So it's similar. Like you're kind of trailing where to go, so that you know where to go next. And it helps you think. So if I'm gonna do it OSCE-wise, here's how I will be palpating deltoids. So let's say in the exam, they're asking the superior attachment of deltoids. So here's how I'm going to do it. So the deltoid muscle is located on the lateral side of your arm. To start, we can go for the lateral epicondyle going superiorly until I find its insertion, which is around here, which is called deltoid tuberosity, and going superiorly until I feel one of the origins, which is the acromion, and palpating going anteriorly or forward would be the acromion area, and going posteriorly at the back would be the spine of the scapula, which would be the origin and the superior attachment of deltoid tuberosity, which is what we're looking for in the exam. Period. You just have to make it simple, especially for palpation, right? You can even start from here. So from let's say, sorry, acromion clavicle area. And did I say it right? I hope I said it right. So again, let me repeat. The superior attachment of deltoids should be spine of the scapula, acromion, and clavicle. It's been a while since I did muscles, but yes, it should be that, right? You just have to highlight what they need. Trail for your own benefit. Steph, what if I don't want to trail for, you just go start in the area that they didn't look for. So in this case, they didn't really look for the origin. They didn't look for the insertions. I can just say, so the deltoid muscle would be here in the lateral side of your arm. It's gonna insert in the deltoid tuberosity, going superiorly until we find the origin, which is the acromion. Going forward would be the clavicle, or anteriorly, and then going backward would be the spine of the scapula. If they want you to prove an action, you can still do the same. The deltoid is the muscle in the lateral part of your arm. It's going to be here on the side. The origins are going to be in the deltoid tuberosity and some parts of on top of your shoulder. And the spine of the scapula, acromion, and clavicle. And the action is the action of deltoid is abduction, flexion, and extension of the shoulder. For this test, I'm just going to resist abduction. So can you please, I'm not going to do that because it's painful for him. Go push this one. So this one would be anterior deltoids. Okay, so basically for palpation purposes, you can go now. Thank you very much. Let's give our demo a big round of applause for being such a good sport, right? Being such a good sport for us. Thank you very much. Now I'm a bit worried of what I've seen today. Oh my goodness. But again, it's kind of a bit messy. I feel like it's a bit messy of how I did it today, but I hope it gave you a clear idea of how to use assessment on an exam purpose and on a clinic purpose. The way I showed it right now is very exam-ish, right? Like if I had extra time, I'll go more and go in depth in explaining, but this one I had to show like I'm doing in an exam. Obviously, it's a bit long because of the explanation, but with proper organization and a simple condition, you can do it within the time frame that they are given. So, before we end the session, still have 10 minutes left. Any questions? Any extra questions from the demo that we have done today? What did you find helpful? comment it down below so at least I can answer them while we are still here. No questions. Thank you. No questions so far. So how did you feel? How did you feel with this FAQ session? Okay, wait. Do you have tips for us who will be taking OSCE? Number one, follow instructions, whatever they say on the STEM, follow it through. Especially for these two stations, just literally, if they say find the problem, all you need to do is find the problem. If they say perform speeds test, perform speeds test. They say perform valence test, perform valence test. Literally go for what they're asking you to do. Don't overthink it. Don't add, don't remove. Just focus on what they're looking for. It feels overwhelming. I hear once for former classmates, another thing from my tutor, so it's confused. That's what I keep saying, like earlier, right? The advices we give as tutors or classmates or friends, family members, or whoever's giving you the advice are just advices. Always stick with the resources. So, for example, today I'm going to admit to you that I'm not really confident about the ULTT testing, right? The ULTT testing, because I haven't done it in a long time. To be honest, I think it's a false positive if I'm just thinking, but I think I did it okay. I think I need to resist it at some point. But I mean, the patient was already in pain. That's why I didn't do it. So I just want to stick with facts. That's why I said if I didn't know it, I have to look it up and learn from. So that's how you can combat and prepare this, right? So would you refer this client to physio? Oh, 100%. 100%, I would recommend him to go to physio because I think, the information that we're missing for this patient is that we didn't ask for his job. So I know what his job is. The thing is that I cannot give you, it's not being private, but on the example, I didn't ask that thing, but I would have, I know that he is in construction. So definitely in that type of environment, learning the environment or the work or the activities of your clients very important. So why am I recommending them for physio? Because they need proper exercise. Why? Because working too much, even though you're working on a physical job, it doesn't mean that it's exercise. Because most of those patients think the same. That, oh, I work a lot, I do construction, I lift this, I lift that, so on and so forth. I don't need exercise. And you do. Because you need to correct the muscles. The muscles needs to strengthen. So I would recommend them for physio. However, besides physio, I'm also recommending them for acupuncture because it seems that this patient really has issues towards the insertions of each muscle, though, some GTO techniques can help them, this patient. I am still not comfortable with just that. So I'm going to recommend acupuncture on these areas plus physio. Chiropractor, sure. I'm also going to maybe refer, but for joint issues mostly, but everything is painful at this point. So maybe any muscular work is what I'm going to be referring. So not just physio, basically everything that solves. I really appreciate you doing this free session. I pay a lot to other tutors to teach me with this, and it's still very confusing. Hey, every tutor has their way of teaching. Everyone has their way of teaching and stuff. All you need to do is ask the question and figure it out and see things going forward. So yeah, I'm really happy that you enjoyed this session. When are you planning to make another session like this? It would be nice to have an overview of the other stations. Yes, for sure. I'm planning to do it every bi-weekly, but I still want feedback from you guys to see what station we should do next to make it interesting, right? To see what's good to do, right? So any feedback for today's thing? I think it's good. I think it went well. But anything else that you need me to know so that I can answer them for you? As we have 5 minutes left. Yes, I definitely need a massage. It's about time. It's gonna get there, right? stay full for this. When will be the recorded session be available? So the recorded session will be definitely continue these sessions. Oh yeah, definitely will. That's why we have the school community, right? So any feedback suggestions would be very kind. Again, I cannot always give you 100% accurate thing, but I'm all I can promise is I stick with facts. So if I'm wrong, feel free to correct me so we can find the right resource to correct, because it is what it is. Uh, the recorded session for school, it would show up right away. Give us a few days, but it's also going to be in YouTube just in case. And again, with your names and everything are going to be covered. Your names are not going to be shown online unless you consent us to. But we're going to assume that no, so we're only going to show the bits, my faces and the demo's face for earlier. Any other questions? Keep them coming. So nobody really won our Tim Hortons gift card because I even gave the answer and nobody still guessed. Okay, that's totally fine. But for the next few weeks, you would receive some questions on our school community asking us for extra things that you want to learn. So go ahead and show that. So in a few days, you're going to get this recording. So at least you're all ready. Any other questions before we end this live session? Say it now or forever hold your peace. I do love the lighting of this room today. Any questions? I would assume that there are no more questions at this point. And I want you to enjoy your Sundays with your families as well. So let's call it a nice live stream session. I'm good. I'll be participating with the next session too. Well, thank you. Thank you very much as well. So let's give us a big round of applause. So if you're in the computer, you can put the clapping emoji for you. Congratulations for staying. And I hope you've learned something there. And again, thank you and enjoy the rest of your Sundays. Again, recording will be posted in a few days. I'll see you soon. Okay, goodbye, everyone.